Many of you have been trained to carry out CPR and might one day be the first person to respond to a patient who has stopped breathing.
Cardiac arrest, can I get some help in here?
Until appropriate PPE has arrived and is worn, you are frustratingly unable to ventilate patients using the traditional bag and mask systems many of you have been trained to use. The risk of inhaling aerosols or coughed droplets is a real concern to first responders. Direct contact with blood, saliva, or vomitus also poses a high risk. The Sarus Hood provides a simple solution to these dilemmas and the risks you face as a CPR responder.
That's it. Just breathe once you're ready.
Okay, ready?
Go.
1,
It's good.
2.
How to use the Sarus Hood in 10 simple steps. Firstly, insert a Goodell airway into the patient's mouth. Gently lift the patient's head and slide the back of the hood underneath. Pull the hood over the patient's head, ensuring that the anaesthetic mask is placed in front of the patient's nose and mouth. Tighten the 2 tension-controlled drawstrings around the neck. Secure the anaesthetic mask over the patient's nose and mouth using a 2-handed grip, and then lift the patient's jaw. Attach a ventilation bag and carry out bag and mask ventilation. If needed, use the closed oral suction unit to remove saliva, blood, and vomitus from the patient's mouth. To do this, firstly attach the suction hose, turn the control valve 90 degrees to switch the suction on, and then push the rigid sucker towards the patient's mouth.
25, 26, 27, 28, 29, 30.
Personnel can safely carry out chest compression, cardioversion, and bag and mask ventilation whilst waiting for assistance. Once an ambulance crew or resuscitation team arrive and have donned full AGP PPE, ask them to remove the hood. The hood must not be removed by staff who are not wearing full PPE. Before removing the hood, turn the suction control valve off, then release the 2 drawstring toggles and carefully remove the hood from the patient. Finally, please dispose of the hood in a clinical waste unit. To recap, firstly insert a Goodell airway, then lift the patient's head and place the hood over the patient's head. Tighten the 2 drawstrings securely around the neck, then attach a ventilation bag and ventilate the patient using a 2-handed bag and mask technique. Once a resuscitation team arrives and are wearing full AGP PPE, ask them to remove the hood and place it in a clinical waste unit. For further information, please visit sarushood.com.